Hi, everybody. My name is Fridah Mwendia. I'm a market development specialist for Sub-Saharan Africa working with IQVIA. I've been involved in clinical research for the last 10 years, and I'm now focused on advocating for clinical research initiatives in Sub-Saharan Africa. My project is on advancing women's leadership in clinical research. Globally, women are underrepresented as leaders in science, especially in clinical research. A 2020 publication in JAMA Internal Medicine, looking at the representation of women in cardiovascular trial leadership, revealed that out of 200 clinical trials examined, only 19 of these had women in 25% of the leadership. This is despite evidence showing that clinical research led by female investigators tends to enroll a higher percentage of women participants, a demographic that has historically been underrepresented. Hence, my project. It aims to address the underrepresentation of women in leadership in clinical research. I'm seeking to understand the barriers and enablers for women, and it will then be followed by a peer mentoring program that seeks to support their advancement in leadership. My vision is to create a balanced and inclusive research community where diverse perspectives enhance global health outcomes. I intend to do this in a phased approach. First, a literature review and a comprehensive analysis of the involvement of female scientists working within research organizations. This will then be followed by the qualitative aspect, which will explore their lived experiences and factors impacting their progression leadership role. This will then culminate in the design and developing of a peer mentoring program. Looking at a snapshot of the literature review conducted in phase 1, we identified some of these barriers as those preventing the ascension of women to clinical research leadership positions. Structural barriers, where there is unequal access to opportunities as well as significant gender pay gap. Research and funding challenges. Institutional barriers, where there is a general lack of family-friendly policies, childcare support, and parental leave policies. Other barriers included intersectional challenges, which look at race and ethnicity, as well as geographical disparity. And finally, we have the elusive work-life balance, where women often face a double burden of balancing their professional responsibilities with their more traditional caregiving roles. With this said, this background information led to the qualitative aspect of my project. I am currently distributing questionnaires to female scientists to elicit their impact and barriers to their progression to leadership roles. I have secured a collaboration with the Clinical Research Society of Kenya to establish a care mentoring program, which seeks to convene groups of women to meet periodically and cultivate an environment of co-learning, as well as develop their readiness for senior leadership roles. In turn, the mentors will learn how they can positively shape the culture of leadership, be more inclusive. This initiative seeks to develop and empower women through women themselves. When I look at my leadership journey, this initiative has the potential to create lasting change by influencing institutional policies and mentoring leaders. Strategically, I believe I have applied strategic thinking in designing the phased approach. This project prioritizes inclusivity by enhancing collaboration across the diverse stakeholders to build a community of support for women. And finally, but most importantly, I have remained authentic, particularly by following my passion of fostering equity in clinical research. Overall, this project resonates deeply with my journey and will provide me with a platform to amplify my impact. Ensure this program has lasting change. I'm committing to expanding the mentorship program by engaging diverse allies, sponsors, and advocates, such as yourselves, in a collaborative environment. By continuously learning and refining the approach, ensure that the program evolves with the needs of its participants. And finally, by championing evidence-based recommendations to develop a scalable model for adoption. This initiative has allowed me to align my personal growth as a leader with my commitment and passion to fostering diversity, equity, and inclusion. By empowering women, we create a ripple effect. Marie Curie once said, "Nothing in life is to be feared, it is only to be understood." And just as she once shattered the boundaries of possibilities in science, the aspiration is to empower women leaders to innovate, inspire, and transform the landscape of scientific research for generations to come. Thank you.